or the 3rd of November. Now, we want to look particularly this evening, first of all, at deaths. How many deaths there's been as a result of this pandemic. Now, in the 1918-19 pandemic, the influenza pandemic, there was probably between 50 and 80 million people died from that. No one's actually quite sure. So in this modern pandemic, you'd think we'd be quite sure and fairly accurate about the figures, but there's quite a lot of uncertainty, as we'll see. But the deaths are much lower than they were in 1918, 1919, which of course was before the antibiotic era. So, but actually, if you think about this pandemic, we're actually 19 months into this now. So we're into this quite a long time. And John Hopkins official data, over 5 million people have died now, according to the Johns Hopkins, which is basically a collation of all the officially government released data from around the world. So basically governments are saying, well, collectively there's been 5 million deaths as a result of SARS coronavirus 2 infection with COVID-19. Total cases are 247 million according to official data, and over 7 billion doses of vaccine given according to official data. Now, I want to focus, as we've said, more on the deaths particularly. Now, we'll start off with the World Health Organization estimates on deaths, and then we'll go on to look at some potentially more accurate estimates after that. Starting with the World Health Organization, check on the site, it's all there. Now, this is based on excess mortality estimates produced for 2020. So this is 2020 data, and we'll see we'll be able to extrapolate this up to modern times. Now, World Health Organization say this. We're likely facing a significant undercount of total deaths, directly and indirectly attributable to COVID-19. Of course, this is fairly self-evident statement. So the actual people that have died from COVID-19 have been underreported globally, and how many knock-on deaths, the sort of collateral damage, if you like, from COVID-19, patients who haven't been otherwise treated, or patients who've died from other intercurrent infections as a result of lockdown, difficulties with lockdown, economic difficulties with lockdowns, and the various policies that have been instigated around the world. These have also caused deaths. And one way to look at this is the total excess mortality in a population, and that's what the World Health Organization is doing here. Now, they do make the proviso that many countries still lack functional civil registrations and vital statistic systems. So we don't have data for the whole world accurately. And they give an example of this, which is useful before we just get down to the specifics. So in terms of registered deaths compared to the actual number of deaths, in Europe, it's at least 98% of deaths are correctly registered. In the African region, 90% of people die unrecorded. Only 10% of deaths are recorded. So interestingly, of the deaths in Africa, 90% of people are simply never written down, 90% of deaths. And they'd just be lost to history, one would assume. So great variance in the official reporting around the world of deaths, making comparison very difficult. And comparisons are also difficult because countries simply record things in different ways. Even sophisticated countries, even say Germany, the UK, Australia and the United States, all record deaths in a slightly different way, so it can be a bit confusing. Now, excess mortality is what is going to be looked at in the World Health Organization data here. And this is the difference in the total number of deaths in a crisis, which we've been in, the pandemic, compared to those expected under normal circumstances. So how many people overall die. So essentially this is ignoring how many people are dying from the pandemic. It's looking at how many deaths there have been overall compared to what you would expect. And of course, if we're looking at overall deaths, that should take into account the deaths from the pandemic directly and the deaths from the knock-on sort of collateral damage deaths from the pandemic as well. So that therefore includes direct and indirect impacts. Now, the WHO 2020, now this is for 2020. So at the end of 2020, there was 1,813,100 official deaths. But the lower bound on that, the lower bound is the World Health Organization put, and that is 3 million deaths. So we can see there was significant underreporting. So here we see this graphic from the WHO. So 1.8 million officially reported deaths, actual number of deaths 3 million or potentially quite a bit more. So at least 3 million. Excess mortality, this is excess deaths over what we would normally expect. So that's the estimate from the World Health Organization. Particularly in the Americas, excess mortality estimated range from 1.34 to 1.46 million, which is about 60% more than reported. So in the Americas, they're saying underreported by 60% more deaths than actually reported. European region, excess mortality estimates range from, for the total deaths, 1.11 million to 1.21 million, about 50% more deaths than reported. So it's even for the European region where you would expect data to be well collected. So America's 6% underreported. Of course, this is for the whole Americas. It's hard to generalise. Europe, 50% underreported. So that was the estimates there from the World Health Organization. Now, the next one I want to go on to is The Economist. Now, The Economist magazine has collected pretty good data all the way through this, actually. And they've got quite useful ways of thinking about deaths. Particularly, they're considering excess deaths as well, like the World Health Organization is. And they take into account about 100 parameters to calculate excess deaths. So this is their calculation now. Actual worldwide death toll, they estimate to be not 5 million, but 16.8 million excess deaths. So basically more than three times the official reported figure for the Economist's calculation of excess deaths. And they say there's a 95% probability that there's between 10.3 million to 19.5 million deaths, is what they are saying. Now, their actual closest estimate is probably we've got 17 million there, but 16.8 million is actually what they are estimating. So even the lower range there, the 10.3 million up to the 19.6 million, we see the degree of underreporting. If it's 10.5, it would be 2.1. If it's 17, it would be 3.4 times and 3.9 times if it's the higher 19.6 excess mortality. So that's the overall figure from The Economist. Now, The Economist is particularly interesting because it actually, as well as giving the overall figures of deaths, it actually gives specific countries. And this is really, some of this data is actually pretty mind-blowing. And this is based on The Economist's models, as we've said. But they are quite sophisticated ones for collecting data from around the world. So official versus actual deaths from The Economist. So first of all, the United States. Official deaths now about 748,000. So basically 750,000 deaths in the United States, pretty high. The actual number they estimate excess deaths are getting on for 1 million. So 860,000 to 1 million from 745,000. So deaths underreported in the United States, according to The Economist. Now, China, they're reporting 4,600 deaths. The actual figure from The Economist is not less than 150,000 and could be 1.7 million. So they basically don't know. There's this massive error bar. So they're saying 150,000 deaths at least in China, but up to 1.7 million. So either way, significantly more than the official reported figure in China of 4,600. So deaths massively, either way you look at it, massively underreported in China. Likewise, in India, this is pretty sobering numbers here as well. 458,000 in India official deaths. The actual number is not less than 1.2 million and could be as high as 7.2 million deaths in India, excess deaths. So India's large population, of course, is getting on for about 1.4 billion now, but Again, we see gross underestimates of the death figures in India are likely when we look at total mortality. So basically 1 to 7 million deaths in India, quite incredible. Russia, likewise, greatly underreported. We've looked at this before. We know deaths in Russia are greatly underreported. The official figure, 236,000. The actual number, 870,000 to 910,000 deaths. So getting on for 1 million deaths in Russia as well. Again, we see underreported by what? Four times probably. Massive underreporting. Indonesia, data often difficult to collect in Indonesia. Official number 143,000, real number 300,000 to 1.2 million in Indonesia. A large population country, of course. Pakistan, again, particularly underreported. 28,477 officially reported. The real number is 300,000 to over 900,000 deaths. So massively underreporting in Pakistan. Likewise in Bangladesh. Official numbers 27,873. Actual numbers 200,000 to 720,000. So again, pretty sobering numbers from Bangladesh. Turkey underreported 71,052. Officially reported. The real number 130,000 to 420,000. Now you notice there's pretty big error bars on these because the data simply is not available. But these are the best estimates made based on multiple data points that they've collected and some artificial intelligence extrapolations, but based on as much data as they can get. But if we take Turkey for example, they're pretty certain it's not less than 130,000. So it's getting on for at least double of the official figures minimum, but could be 420,000. So there are these error bars. Mexico underreported 288,000 reported. The actual figure 560 to 600,000. Brazil, fairly accurate actually. 408,000 deaths reported officially in Brazil. The actual numbers 660 to 740,000. And looking at the UK, as we know, where we do have accurate figures, the UK official deaths 28 days after a diagnosis, 141,000. UK excess mortality is actually less, and we know what it is. It's not an estimate. It's between 130,000 and 130,000. In other words, it is accurate. So some pretty sobering underreporting there. In fact, here's a graphic for the overall global underreporting. So these are the official deaths along the bottom here from The Economist. The red line is the line of most probable excess deaths. The red error bar here is the 50% error, potential error, and the grey is 95% potential error. So pretty clear there, any way you look at it, even with the absolute lowest estimates, totally lowest estimates, way higher than the official figures. So governments underreporting for whatever reasons around the world. Quite a startling graphic there, really, from The Economist. Just a few things to bear in mind. Death tolls are heavily influenced by the age structure of a country's population. And we're going to be looking at Africa hopefully tomorrow because it's got a young demographic, is one of the reasons why the deaths there thankfully have been relatively low, and we're going to give evidence for why that is probably true. But that not on this video. Rely on the assumption that officially published excess mortality numbers are accurate, which of course often they are not. But somewhere like Russia, for example, where the overall figures are completely unreliable, we do know that people have collected data from all the regional areas in Russia where deaths are still accurately recorded in the various regions where there's less central control. And you can add those all up, of course, and so we do have fairly accurate figures from Russia in that regard. COVID-19 disruption. Some governments may have changed how they compile the data. People have been off, people working from home, all that kind of thing, so that casts doubt on it. And there is no doubt at all that some governments, I'm not going to name them, I've been looking at some, but some governments have fiddled the numbers, no question about that. I'm not going to give you more information because I can't give hard evidence for that at the moment, but there are. If you look on the Economist site, you'll see that some countries have fiddled it overtly because they've actually changed the numbers retrospectively, looking back, and fiddled it to make them kind of adjust. to be more consistent with their fiddling. Now, last one I want to look at, Institute for Health Metrics and Evaluation. This is based University of Washington, of course. There's the official site there. Huge amount of really quite impressive data on that. Now, they looked at this differently. They tried to estimate the actual number of deaths, the total number of deaths, not in excess mortality, but the total deaths estimated for the number of deaths attributable to COVID-19 specifically, including underreported deaths, and their estimate is at least double the official numbers. So the official numbers just over 5 million. Their estimate 11.9 million directly attributable to COVID-19. And here's their graphic that illustrates that. So here we have the official numbers going along on the orange, and then on the light green we have their estimated, more accurate numbers. And we see consistently governments have been underreporting for one reason or another. So that's the officially reported, that's the actual number of deaths. Quite interesting as well to look at their extrapolations into the next month or so. So here we are at the moment, 3rd of November. So the actual number of deaths they predict is going to carry on going up. Well, of course it's going up because people can't come back to life. This is a cumulative number. So, but there are people still going to be dying, even though at a greater rate, because that line is going up more steeply than the official line there. The red line is the higher estimate, the green line is the lower estimate, the purple line is the likely estimate. So this problem is going to be going on until early next year. And as I've said quite a few times, in terms of Western countries with high vaccination rates, Australia, New Zealand, Canada, United States, UK, Europe, I do expect the numbers to start going down fairly dramatically due to herd immunity effects early in the new year, early in 2022. But let's just pause and remember that all of these official statistics represent individuals. And I think we'll leave today's talk there, and thank you for watching.